So primarily I do labiaplasty. There's a group of female plastic surgeons that get together routinely and discuss this, but so I'm copying this phrase from one of my friends, but she's an unapologetic trimmer, meaning that she does a curvilinear trim technique. So that means that you're gently curving the incision along the edge of the labia. It does a couple of things. You can get very good symmetry that way. You can easily match the length left behind so that you can have it um, be behind the labia majora. So it's easy to mark it that way. It heals really well. The scar is imperceptible when it heals. It removes a lot of times the edge of the labia is hyperpigmented, and women tend to want to have that removed. So by hyperpigmented, I just mean darker in color than the rest of the labia. And so you remove that when you're doing the curvilinear trim. Um, the other major way of doing labiaplasty is a wedge technique, and so that is taking out, like, kind of like a pizza slice piece out of the labia and then, sewing it together. One of the pros of that is that the incision is on the inside, it's internal, but it doesn't remove hyperpigmented areas. It is really prone to healing problems just because I won't go into the blood supply to the labia minora, but it doesn't really lend itself to this technique. You have to be pretty careful. Also, you cannot, you can't get quite the amount of resection that you can do sometimes with a trim. Resection is the amount of tissue that you're going to remove. So you're a little limited with a wedge technique in that you can take out a pretty large wedge, but if you do, you can create tension in places that you don't really want it, which can again either heal to unfavorable scarring or wound healing problems, neither of which you have with the trim technique. So I always tell my patients that they're going to be in the office for about 2 hours. The surgery itself takes an hour, but because my patients are awake and we're doing this under local, we're not trying to rush them along. So it's a kind of a measured, like they come in, they get their photos. I don't take photos at their initial consult just because it's a lot to take photos. And if you're not going to have the surgery, I don't need photos. So, but that means that when you come in for your actual appointment, we're going to take photos, have you sign the consents. We'll put topical numbing cream on. That numbing cream is really strong. And because that area is mucosa, it takes to the numbing cream really well. You can take an oral sedative. We offer that. You just need to ride home if you do that. So most of my patients actually don't take the sedative because if you're not nervous about the procedure, if you're pretty confident you're not gonna have pain or you think you have a high pain tolerance, then you're gonna be fine because none of this is gonna hurt. It's just more about being nervous about what the procedure is gonna entail. So those patients will take an oral sedative. And then after the numbing has been in place for a while, what I do is I wipe it off, I do the markings, and then I show the patient what the markings look like. And then once the markings are confirmed, then I inject the actual local anesthetic. But because the topical works so well, you don't feel the numbing going in. And then once you're numb, then we do the procedure. So it's myself and Bree, my scrub tech in the room, and my patients do a variety of things while we're doing the procedure. So they will chit chat with us. They can be on their phones. They can listen to a podcast. They can watch Love Island on their phone if they want to. A lot of them are watching Love Island right now. But we usually talk about, because the new season's out, we usually end up talking about like current events in like pop culture and like chit chat. So it's the patients who take a sedative sometimes take a nap, honestly, but it's pretty entertaining, the conversations we have. That's part of the fun. We promise them that it'll be more fun than they think it's going to be because we're entertaining to some degree, but they might be dumber after the procedure because we do the deep dive into actually stupid celebrity stuff. So we've had all kinds of riveting conversations about, like, I don't know, Jeff Bezos and Lauren Sanchez. We've broken down the Justin Baldoni issue, like, trial, P. Diddy. We'll talk about local stuff going on. It's kind of bananas, or TV shows. We like to ask our patients, like, "So after the surgery, you're gonna need to lay flat for 3 days. Kinda take it easy." So, we'll talk to them about whether they're gonna read certain books or they're gonna watch certain shows and what they've stockpiled for watching TV shows. So that's usually a nice, segue into the conversations we had. I had one patient come from China, and her sister, she only spoke Chinese, so her sister did all the translating, and that was one of the more boring labiaplasties to do because her and her sister chit-chatted the whole time, and Bree and I were just like, "La-di-da." We don't know. They were cute. Like, you could tell they were just giggling and, sister talk, but we couldn't understand any of it. I feel like San Diego is, like, sometimes a destination place for plastic surgery. So, we had a patient from Montana who had lived here before and then moved to Montana, and then, came out here for the labiaplasty, um, because you know people that you could friends that you can recover with, and then you can go back. And that was, like, peak Yellowstone time when that was a hit, and so she had almost convinced Bree to move to Montana by the end of the procedure, talking about how great it was. I was like, "Oh, when are you gonna tell her that it snows?" And she was like, "Wait, what?" I'm like, "Girl, you're not gonna make it in Montana. You can't do the cold." Mm-mm. But, yeah, from all kinds of places. China's probably the farthest.